Thank you for joining me today. In this video, you will learn early eating disorder for infancy and early childhood. Eating disorder for infancy and early childhood. So, eating disorder of infancy and early childhood is a disorder characterized by a persistent discrepancy in eating behavior, resulting in altered consumption or absorption of a food. It is a neurological development disorder. Causes a significant impairment in a physical and growth and or psychosocial function. Typically present in infant and early childhood without body image disturbance, it's unlike the teenager or adult eating disorder. It's not similar to the or same as the eating disorder for adult and teenagers. Eating disorder in early childhood These disorders are previously grouped as feeding disorder of infancy and early childhood, they are Pica, rumination disorder, avoidance and restrictive food intake disorder, so Pica is a persistent ingestion of non-nutrition, non-food substance. Example will be eating a dirt, clay, paint, peppers, behavior that is inappropriate for developmental level, non-cultural sensation that happens in a 1 month or greater, may occur with ID or autism spectrum during the pregnancy, but may be severe enough to warrant a clinical attention. If it gets worse or out of control or risky, that needs a clinical attention. Risky and complications include lead toxicity. If they eat paint, they may get lead toxicity. It can lead to GI obstruction. It can lead to infection. It can lead to nutritional deficit. Interventions include behavior interventions is the first line of treatment. Correction, neurological deficit, like the iron, if they are deficit, if they have an iron deficit or zinc deficit, you want to correct that. Environmental safety, you want to remove the access to the ingestion atoms. You want to remove the items that they want to eat. If they're eating paper, you want to take the paper out of the room. You want it, if they are eating rockies or dirty or paint, you want to limit their access. You want to treat their comorbidity conditions like ASD, autism spectrum. You want to educate the family and supervisors. Rumination disorder. Core features include rapid regurgitation and rechewing of a food occurs after eating that is not due to GI or medical condition. Onset is usually in infants, leads to weight loss, failure to thrive. Interventions and treatments include behavior therapy is the first line of therapy, habit reversal, distraction techniques, improve caregivers and child interaction during the feeding, nutritional rehabilitation, address the psychosocial disorder or stress, monitor growth and developmental delay, avoidance and restrictive food intake disorder. Core features include avoidance or restricting of a food intake leading to weight loss, failure to gain weight, nutritional deficit, dependency on supplement or enteric feeding, psychosocial impairment. They have a fear of gaining weight or body image disturbance. Motivation include sensitivity, fear of choking or vomiting, lack of interest eating. Those are the motivations that cause the patient to do these things. So the interventions are multidisciplinary approach is the gold standard. Pediatric clinicians, mental health providers, nutritionists, occupational and speech therapy, feeding skills. So interventionists combine those fields. Pediatric providers, mental health providers, nutritionists, occupational therapy, speech therapy, feeding skills, behavior feeding therapy, gradual feeding exposure and desensitization. You want to coach the caregivers. Nutritional supplement as needed. You want to provide nutritional supplement. Treatment, you want to treat comorbidity like anxiety, neurodevelopmental disorders, assessment across the disorders. You want to do full medical evaluation to rule out organic causes, developmental history, direct observation of a feeding, growth chart evaluation, nutritional assessment. You want to evaluate the patient-child feeding interaction, differential diagnosis include failure to thrive, GI disorder, autism spectrum disorder, neglect. Prognosis include many feeding problems are transient. Persistent disorder risks include poor growth, developmental delay, later eating disorder. It can lead to later as adult eating disorder. Early intervention and intervention improves the outcome. No body image disturbance leads to feeding disorder. Behavior intervention is more beneficial than a medication. Feeding disorder of infants, always rule out medical causes first. Growth failure to thrive is the red flag. Thank you for joining me today. I would love to see you in my next video. Thank you.